Now we're going to talk about why do people get more prone to have rhythm problems or heart disease?
Yeah, there are a number of risk factors, and a lot of them that we can control are environmental. The real answer is genetics, probably, but we can't control our parents. The risk factors we do know for cardiac arrhythmias are the usual for atherosclerosis or coronary disease, meaning hypertension that's uncontrolled, diabetes. The other thing we have figured out is that untreated sleep apnea, if you don't breathe well at night, that interrupted breathing can also trigger more arrhythmias.
So we need to be careful if people are snoring and stop the snoring,
Absolutely.
obstructive sleep apnea. So that can cause damage direct to the heart.
Yeah, and it absolutely, the hypoxia or the lack of oxygen in the middle of the night when you stop breathing, heart gets irritable. And a lot of the times that I find my patients have arrhythmias, the minute we get their sleep apnea treated, the rhythm problems can go away.
It should be a great thing to see happen if you get rid of the snoring and the sleep apnea, that the patient's rhythm problem goes away. What else can cause rhythm problems?
There's the historic or classical kind of the term we use is holiday heart syndrome, where
What's that?
And so that's when historically people go to Christmas parties and have a little too much wine during those parties, that can also trigger arrhythmias.
So alcohol to an excess
Yeah.
can cause a sudden rhythm disturbance,
It can
or
certainly-
the chronic use of a little bit too much for a longer period of time.
Both binge drinking, 1 or 2 servings, not going to, but a binge drinking, defined as 2 or 3 more in an hour, or more than 5 in an evening, certainly can trigger AFib episodes. And I find that if I can get some of my patients to just abstain from alcohol, that gets rid of their heart rhythm disturbances
Smoking?
too. Smoking can. Certainly.
So-
and we used to think caffeine did until recent studies showed that caffeine actually reduces the arrhythmia risk now.
Thyroid disease?
Thyroid disease can if it gets really bad and untreated, so thyroid toxicosis can.
So if the thyroid gets overactive, it can bother the heart. How about if it gets underactive?
That will cause the heart to become slow, and so we'll get slower heart rhythm disturbances. It can certainly cause your heart to be weak if we have too little thyroid hormone. Thyroid hormone is kind of like the natural caffeine for your body, so you can kind of think of it in that terms. Too much, it's going to stimulate you. Too little, you're going to kind of drag.